Hey everyone, I'm here. Did you know that 50% of people taking multiple medications don't take them the way they are supposed to? Skipping doses or not taking medications as prescribed can be dangerous and in some cases even life-threatening. That is why it is so important to understand why we take medications the way we do and what can happen if we don't. Let's start with the basics. What is medication adherence and why is it important? Medication adherence, also known as medication compliance, is taking your medications exactly as prescribed by your doctor. This means taking the right dose at the right time every time. It is important because it ensures that your body has enough of the medication it needs to work properly. When you don't take your meds as prescribed, it's called non-adherence or non-compliance, and it can lead to some serious issues. So why do people not adhere to their medication regimen? There are many reasons why someone might not take their medication as prescribed. Some common ones include not understanding how to take the medication, having side effects, being too busy, or simply forgetting. Whatever the reason, the consequences of not taking medication as prescribed can be serious. When you don't take your medication as prescribed, it can lead to a loss of effectiveness, meaning that the medication will not work properly and may not treat your condition as intended. In some cases, it can also lead to the development of drug resistance, which means that the medication will no longer work at all. This is a big problem with antibiotics. When we don't complete the full course of antibiotics as prescribed, it can cause the bacteria to become resistant to the antibiotic, making the infection harder to treat in the future. Not taking medication as prescribed can also lead to an increased risk of side effects. When you don't take your medication as directed, it can cause the levels of the medication in your body to become too high or too low. This can cause the medication to work improperly and increase the likelihood of side effects occurring. In some cases, not taking medication as prescribed can be life-threatening. For example, if you have a chronic condition like diabetes or high blood pressure and you don't take your medication as prescribed, it can lead to serious complications such as heart disease, stroke, or kidney disease. So what can you do to ensure that you take your medication as prescribed? Here are a few tips. Make sure you understand how to take your medication. If you're not sure, ask your doctor or pharmacist. Set reminders or use a pill organizer to help you remember to take your medication. Don't skip doses unless your doctor tells you to, and if you miss a dose, just take it as soon as you remember. But if it's almost time for your next dose, skip the missed dose and move on. Don't take more medication to make up for missed doses. And finally, talk to your doctor about any side effects you're experiencing. There are often other medications that can be used to treat the same condition with fewer side effects. I hope this video was helpful. Remember, taking medication as prescribed is essential for your health and well-being. So make sure to follow these tips to stay on track. Thanks for watching.